Aricept is well tolerated, but not for everyone. People at risk for stomach ulcers or who take certain other medicines should tell their doctors because serious stomach problems such as bleeding may get worse. Some people may experience fainting. Some people may have nausea, vomiting, diarrhea, bruising, or not sleep well. Some people may have muscle cramps or loss of appetite or may feel tired. In studies, these were usually mild and temporary.
Mom. Do not take Belsomra if you have narcolepsy. When taking Belsomra, don't drive or operate heavy machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Belsomra should not be taken together with alcohol. Abnormal behaviors may include aggressiveness, confusion, agitation, or hallucinations. The temporary inability to move while falling asleep or waking up and temporary leg weakness have also been reported. In depressed patients, worsening depression, including risk of suicide, may occur. Alcohol may increase these risks. Side effects include next-day drowsiness.
Do not take Belviq if you're pregnant, planning to be, or nursing. Before taking Belviq, tell your doctor if you take medicines for depression, migraines, mental problems, or a cold, as these medicines with Belviq may cause serious or life-threatening side effects. Call your doctor if you have confusion, sweating, fever, or stiff muscles. Some people taking medicines like Belviq have had heart valve problems. Call your doctor if you have trouble breathing, swelling, dizziness, fatigue, or a regular heartbeat. Don't drive or operate heavy machinery until you know how Belviq affects you. High doses may cause mental problems. Talk to your doctor if you become depressed or have thoughts of suicide. In patients with type 2 diabetes, weight loss may cause low blood sugar. Stop taking Belviq and tell your doctor if you have prolonged erections or your breasts begin to make milk or increase in size. Belviq may decrease blood cell count. Common side effects include headache, dizziness, fatigue, nausea, dry mouth, constipation, back pain, and cough.
Biaz is a different type of hormone that for some may increase potassium too much. So don't take Biaz if you have kidney, liver, or adrenal disease because this could cause serious heart and health problems. Tell your doctor if you're on daily long-term treatment for chronic conditions like cardiovascular or inflammatory diseases. Serious risks include blood clots, stroke, and heart attack. Smoking increases these risks, especially if you're over 35, so don't smoke on Biaz. Don't take the pill if you've had any of these conditions, certain cancers, or could be pregnant. The pill does not protect against HIV or STDs.
Tell your doctor about all your medical conditions and medicines, and ask if your heart is healthy enough for sex. Do not take Cialis if you take nitrates for chest pain, as it may cause an unsafe drop in blood pressure. Do not drink alcohol in excess. Side effects may include headache, upset stomach, delayed backache, or muscle ache. To avoid long-term injury, get medical help right away for an erection lasting more than 4 hours. If you have any sudden decrease or loss in hearing or vision, or any allergic reactions like rash, hives, swelling of the lips, tongue, or throat, or difficulty breathing or swallowing, stop taking Cialis and get medical help right away.
One ingredient in Contrave may increase suicidal thoughts or actions in some children, teens, and young adults in the first few months. Serious side effects are mood changes like depression and mania, seizures, increased blood pressure or heart rate, liver damage, glaucoma, allergic reactions, and hypoglycemia. Not for patients with uncontrolled blood pressure, seizure history, anorexia, bulimia, drug or alcohol withdrawal, on bupropion, opioids, MAOIs, allergy to the ingredients, or pregnant. May cause nausea, constipation, headache, and vomiting.
Crestor is not for everyone, including people with liver disease. And women who are nursing, pregnant, or may become pregnant. Simple blood tests are needed to check for liver problems. Tell your doctor about other medications you're taking, or if you experience muscle pain or weakness, as that may be a sign of serious side effects.
Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thyroidazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing of the skin or eyes. Talk with your doctor about your medicines, including those for migraine, or if you have high fever, confusion, and stiff muscles, to address a possible life-threatening condition. Tell your doctor about alcohol use, liver disease, and before you reduce or stop taking Cymbalta. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation.
Don't stop taking Eliquis unless your doctor tells you to, as stopping increases your risk of having a stroke. Eliquis can cause serious and in rare cases fatal bleeding. Don't take Eliquis if you have an artificial heart valve or abnormal bleeding. While taking Eliquis, you may bruise more easily, and it may take longer than usual for any bleeding to stop. Seek immediate medical care for sudden signs of bleeding, like unusual bruising. Eliquis may increase your bleeding risk if you take certain medicines. Tell your doctor about all planned medical or dental procedures.
Women who are pregnant must not take Entresto. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or Aliskiren. If you've had angioedema while taking an ACE or ARB medicine, don't take Entresto. The most serious side effects are angioedema, low blood pressure, kidney problems, or high potassium in your blood.
Humira can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers, including lymphoma, have happened, as have blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure. Before treatment, get tested for TB. Tell your doctor if you've been to areas where certain fungal infections are common, and if you've had TB, hepatitis B, are prone to infections, or have flu-like symptoms or sores. Don't start Humira if you have an infection.
Latuda is not for everyone. Call your doctor if you have unusual changes in mood, behaviors, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Latuda have an increased risk of death or stroke. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these may become permanent. High blood sugar has been reported with Latuda and medicines like it, and in some cases, extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be fatal, dizziness upon standing, seizures, increased cholesterol, weight gain, increased prolactin levels, impairment in judgment, or trouble swallowing. Avoid grapefruit and grapefruit juice while taking Latuda. Use caution before driving or operating machinery.
Do not use Levemir if you are allergic to any of its ingredients. The most common side effect is low blood sugar, which may cause symptoms such as sweating, shakiness, confusion, and headache. Severe low blood sugar can be serious and life-threatening. Ask your doctor about alcohol use, operating machinery, or driving. Other possible side effects include injection site reactions. Tell your doctor about all medicines you take and all of your medical conditions. Check your blood sugar. Your insulin dose should not be changed without asking your doctor. Get medical help right away if you have trouble breathing, sweating, extreme drowsiness, swelling of your face, tongue, or throat, dizziness, or confusion.
It's not for everyone. Tell your doctor right away about any serious allergic reaction that causes swelling or affects breathing or skin or changes in eyesight, including blurry vision or muscle pain with fever or tired feeling. Some of the most common side effects of Lyrica are dizziness, sleepiness, weight gain, and swelling of hands and feet. Do not drink alcohol while taking Lyrica. You should not drive or operate machinery until you know how Lyrica affects you.
Do not take Neulasta if you're allergic to Neulasta or Neupogen. Ruptured spleen, sometimes fatal, as well as serious lung problems and allergic reactions have occurred. Report abdominal or shoulder tip pain, trouble breathing, or allergic reactions to your doctor right away. In patients with sickle cell disorders, serious, sometimes fatal crises can occur. The most common side effect is bone and muscle ache.
Don't use Onexton if you have Crohn's disease or colitis, inflammation of the colon, or had colitis or severe diarrhea with past antibiotic use. Stop use if you develop severe watery or bloody diarrhea or severe abdominal cramps, as these may be fatal. Do not use if allergic to clindamycin, benzoyl peroxide, lincomycin, or any of the ingredients in Onexton. Stop use and call your doctor if you have an allergic reaction, as this can be serious. The most common side effect is skin irritation, especially if used with other acne products. Stop use and call your doctor if you have a rash or very red, burning, itchy, or swollen skin. Limit your time in the sun. Avoid tanning beds and sunlights.
Phena is not for everyone and may increase your risk for uterine cancer, strokes, or blood clots, and should not be used in women with these conditions or any of the following: unusual vaginal bleeding, heart attacks, severe liver problems, pregnancy, or breast cancer, as it wasn't studied. So talk to your doctor regularly about continuing Osphena. Call your doctor right away if you have unusual vaginal bleeding, changes in vision or speech, sudden severe headache, leg or chest pain, or shortness of breath. Side effects may include hot flashes, increased sweating, muscle spasms, and vaginal discharge.
Do not take Repatha if you are allergic to it. Repatha may cause allergic reactions. Signs include redness, severe rash or itching, swollen face, or trouble breathing. The most common side effects include runny nose, sore throat, common cold symptoms, flu or flu-like symptoms, back pain, and redness, pain, or bruising at the injection site.
Don't use Premarin vaginal cream if you've had unusual bleeding, breast or uterine cancer, blood clots, liver problems, stroke, or heart attack, are allergic to any of its ingredients, or think you're pregnant. Side effects may include headache, pelvic pain, breast pain, vaginal bleeding, and vaginitis. Estrogens may increase your chances of getting cancer of the uterus, strokes, blood clots, or dementia, so use it for the shortest time based on goals and risks. Estrogen should not be used to prevent heart disease, heart attack, stroke, or dementia.
Do not take Trulicity if you have a personal or family history of medullary thyroid cancer, if you have multiple endocrine neoplasia syndrome type 2, or if you're allergic to Trulicity. Stop Trulicity and call your doctor right away if you have a lump or swelling in your neck, severe stomach pain, or symptoms like itching, rash, or trouble breathing. Serious side effects may include pancreatitis. Taking Trulicity with a sulfonylurea or insulin increases your risk for low blood sugar. Common side effects include nausea, diarrhea, vomiting, decreased appetite, and indigestion. Some side effects can lead to dehydration, which may worsen kidney problems.
Breo is not for asthma. Breo contains a type of medicine that increases risk of death in people with asthma. It is not known if this risk is increased in COPD. Breo won't replace rescue inhalers for sudden COPD symptoms and should not be used more than once a day. Breo may increase your risk of pneumonia, thrush, osteoporosis, and some eye problems. Tell your doctor if you have a heart condition or high blood pressure before taking Breo.
Xeljanz can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections, lymphoma, and other cancers have happened. Don't start Xeljanz if you have an infection. Tears in the stomach or intestines, low blood cell counts, and higher liver tests and cholesterol levels have happened. Your doctor should perform blood tests before you start and while taking Xeljanz, and monitor certain liver tests. Tell your doctor if you are in a region where fungal infections are common, and if you have had TB, hepatitis B or C, or are prone to infections.
When taking Ambien CR, don't drive or operate machinery. Sleepwalking and eating or driving while not fully awake with memory loss for the event, as well as abnormal behaviors such as being more outgoing or aggressive than normal, confusion, agitation, and hallucinations may occur. Don't take it with alcohol as it may increase these behaviors. Allergic reactions such as shortness of breath, swelling of your tongue or throat may occur and in rare cases may be fatal. Side effects may include next day drowsiness, dizziness, and headache. In patients with depression, worsening of depression including risk of suicide may occur. If you experience any of these behaviors or reactions, contact your doctor immediately.
All prescription NSAIDs, including Celebrex, may increase the chance of heart attack or stroke, which can lead to death. This chance increases if you have heart disease or risk factors such as high blood pressure or when NSAIDs are taken for long periods. NSAIDs, including Celebrex, increase the chance of serious skin or allergic reactions or stomach and intestine problems such as bleeding and ulcers, which can occur without warning and may cause death. Patients also taking aspirin and the elderly are at increased risk for stomach bleeding and ulcers. Do not take Celebrex if you've had an asthma attack, hives, or other allergies to aspirin, NSAIDs, or sulfonamides. Get help right away if you have swelling of the face or throat or trouble breathing. Tell your doctor about your medical history and find an arthritis treatment that works for you.
Do not take Intermezzo if you have had an allergic reaction to drugs containing zolpidem, such as Ambien. Allergic reactions such as shortness of breath or swelling of your tongue or throat may occur and may be fatal. Intermezzo should not be taken if you have taken another sleep medicine at bedtime or in the middle of the night, or drank alcohol that day. Do not drive or operate machinery until at least 4 hours after taking Intermezzo when you're fully awake. Driving, eating, or engaging in other activities while not fully awake without remembering the event the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. Alcohol or taking other medicines that make you sleepy may increase these risks. In depressed patients, worsening of depression, including risk of suicide, may occur. Intermezzo, like most sleep medicines, has some risk of dependency. Common side effects are headache, nausea, and fatigue.
Jardiance can cause serious side effects, including dehydration. This may cause you to feel dizzy, faint, or lightheaded, or weak upon standing. Ketoacidosis is a serious side effect that may be fatal. Symptoms include nausea, vomiting, stomach pain, tiredness, and trouble breathing. Stop taking Jardiance and call your doctor right away if you have symptoms of ketoacidosis or an allergic reaction. Symptoms of an allergic reaction include rash, swelling, and difficulty breathing or swallowing. Do not take Jardiance if you are on dialysis or have severe kidney problems. Other side effects are sudden kidney problems, genital yeast infections, increased bad cholesterol, and urinary tract infections, which may be serious. Taking Jardiance with a sulfonylurea or insulin may cause low blood sugar. Tell your doctor about all the medicines you take and if you have any medical conditions.
Don't use Kylena if you have a pelvic infection, get infections easily, or have certain cancers. Less than 1% of users get a serious infection called PID. If you have pelvic or stomach pain, or if Kylena comes out, talk to your OBGYN. Kylena may attach to or go through the uterus. Pregnancy with Kylena is uncommon but can be life-threatening and may cause loss of pregnancy or fertility. Ovarian cysts may occur but usually disappear. Bleeding and spotting may increase in the first 3 to 6 months and remain irregular. Periods over time usually become shorter, lighter, or may stop. Kylena does not protect against HIV or STDs.